So with no further ado, I'm going to hand over to Jordelle. Welcome, Jordelle. It's lovely to have you here.
Brilliant. Thank you, Donna, and thank you for that lovely introduction. Good morning, everyone. It's lovely to see you all here. Thank you so much for attending this Speak Up lecture today. My name's Jordelle Akinola, and I'm here to speak about the Patient and Carer Race Equality Framework. And so I'll just share my screen now and start presenting. So the Patient and Carers Race Equality Framework is NHS England's first ever race equity framework, and it's about improving the racial accountability of all NHS trusts. So it's applicable to mental health trusts and service providers across NHS England. And it's about supporting trusts to prioritise and demonstrate how they'll be making improvements and changing and improving the cultural competence of their organisation. So the aim of the Patient and Carer Race Equality Framework is to improve the access, experience and outcomes for racialised and culturally diverse communities. So the PCREF is a practical tool that helps trusts to work with communities to understand their priorities. And it's about establishing what steps a trust can take to achieve those practical improvements in reducing racial bias. And what we're really hoping is that it will inform and enable service transformation. But the key part to this is that it's co-created and co-produced with our service users, carers, and our community support partners. So it will become part of a mandatory part of the CQC, that's the Care Quality Commission inspections, and also the Equality and Human Rights Commission inspections. And it aligns with things such as the NHS Constitution, the NHS Long-Term Plan, the Core 20+5 approach, the Advancing Mental Health Equality Strategies, and then more locally to us, the North Central London Integrated Care System Population Health Framework. So the PCREF, the Patient and Carer Race Equality Framework, is comprised of three core components. And the first component is leadership and governance. And this is about having a strong leader at executive level who will oversee the delivery and implementation of the PCREF. And at the North London Mental Health Partnership, that role, the senior responsible officer, has been taken by our chief nursing officer. There are 12 key pieces of legislation and regulatory requirements which significantly impact racialised and ethnically and culturally diverse communities. And these are things such as the Care Act, the Use of Force Act. And it's about looking at those and making sure that we view it with a lens of equalities, particularly for our diverse communities, and how they can be impacted differently when underneath those acts. And so all trusts are expected to embed the PCREF into their governance structures to become part of business as usual, and making sure that it feeds up throughout the organisation. And part two of the PCREF is organisational competencies. And this is essentially asking, what is a culturally competent trust? And within this part, it's about working with our local community networks, such as yourselves, our ethnic-led voluntary sector community organisations, and also our service users and carers, to identify opportunities to strengthen and purposely deliver these organisational competencies. And the focus on these organisational competencies is about making those transformations to services so that we're better meeting the needs of our diverse communities. And then part three is about the patient and carer feedback mechanism. And this is about improving the use of our data, and particularly data that affects and impacts our diverse communities, and making sure that it's allowing us to learn from the data, and that we've got a holistic view of how our service users and carers are faring when using mental health services. So it's about looking at the qualitative as well as the quantitative. So there are some key pieces of information that have to be reported, but it's also about using things such as our friends and family test data, and understanding exactly what our service users and carers are saying to us, and then making sure that we're demonstrating how we're using this information and feeding it into our actions to address discrimination. So On the right-hand side, you'll see that at the North London Mental Health Partnership, we've embedded PCREF into our governance structure. At the bottom, we've got task and finish groups, which will be responsible for carrying out and implementing specific actions from our PCREF plan. And then we've also got the PCREF working group. And this is where we bring everybody together and we talk about the PCREF. We decide the actions and what we want to take forward, as well as our organisational competencies that we'd like to see. This then feeds up into our service user health inequalities workstream, which then goes up to our equality, diversity and inclusion programme board, as well as our people and culture committee and our partnership quality and safety committee. And this then goes right up to our partnership board. So part two, the organisational competencies, which is asking essentially what a culturally competent trust looks like. When NHS England were developing the PCREF, they worked with 4 pilot sites, including Birmingham and Solihull in South London and Maudsley. And there was an overall consensus that there were 6 areas of focus for what makes an organisation culturally competent. And these 6 areas that were identified were cultural awareness, staff knowledge and awareness, partnership working, co-production, workforce and co-learning. So in order to make sure that we're enacting these cultural competencies effectively, we'll need to make sure that they're co-produced. So it's not about us dictating to communities, it's about working with communities and engaging with them to find out exactly what they want and what good looks like under each of those competencies. We'll also need to be conducting a self-assessment to give us a baseline measure of where we are, how we're performing as a partnership with our community partners. And then we'll be using that to reflect on where our strengths are and also where we need to develop these cultural competencies. So part 3, the patient and carer mechanism, as I briefly alluded to earlier. So this is about really understanding the experiences of our diverse communities and then using that information and feedback to drive changes locally. So it's a chance to explore what information we know and what information that is culturally informed to help us deliver specific areas that we need to improve on, and making sure that, you know, that there are, like I said, the standard sets of metrics that we report on, but actually what can we use to tell us specifically about our diverse communities. And it's about using those measures to identify gaps in our services and making sure that we demonstrate accountability for improving services and embedding that cultural change to improve experiences and outcomes. And as well as making sure that we've got that holistic picture, we also need to make sure that we are making an impact in the areas that we want to make an impact. And it's about closing that feedback loop. One of the things I think we're great at the North London Mental Health Partnership is looking at our data, analysing our feedback, making changes where necessary. But it's about making sure that we feed that back to our service users, carers and communities to let them know what we're doing and how we've taken a trauma-informed approach and how we're being timely about our responses, and making that information accessible to people, making sure that they're able to access it, or they know which meetings they can come along to, which governance meetings they can attend, so that they can be kept in the loop. And then it's about making sure that when we're looking at this feedback, that we're having that desired impact and change. So at the North London Mental Health Partnership, our local PCREF priorities, as well as working with our communities, we've also reviewed our data. And so far, our data tells us that for our Black, Asian and minority ethnic service users, we've got overrepresentation, particularly with mental health act detentions. And this is even more significant amongst our Black community, and especially our Black men are significantly overrepresented. This isn't just something that's local to us, it is a national picture that Black men in particular are overrepresented in mental health detentions, but it's something that we are seeing reflected locally within our 5 boroughs. And we also see that people are less likely to access early intervention services until they reach the point of crisis. And people from Black, Asian, minority ethnic communities have been found to have higher levels of common mental health disorders such as depression and anxiety, as well as severe mental illness such as schizophrenia, bipolar disorder across our 5 boroughs. And we've also found that people from our diverse communities also have poor experiences when using our services. they're less likely to rate our services as good or very good, and they've also got worse outcomes when it comes to people from non-BAME backgrounds. We've also heard from our community and service users that they would like more help within the community rather than having to come into hospital settings. So what has all our intelligence told us? So within my team, the Equality, Diversity and Inclusion team, we recently produced a State of Inequalities report, and it highlighted those areas on the left where there is significant health inequalities. And we've made recommendations that these are to be taken forward in our PCREF plan. We've also got the North London Mental Health Partnership 5-year strategy, and this has specific deliverables in relation to our Black, Asian and minority ethnic service users and carers, and that need to be taken forward again via the PCREF. We've also got the North Central London Integrated Care Board Outcomes Framework and Adult Mental Health Delivery Plans, and again that's linking in with the PCREF to make sure that there is that continuation of addressing health inequalities as a system. And we had a community engagement report that was recently undertaken, and again that was working with local communities in Haringey, and that highlighted things such as there's still a lack of awareness of service provision for mental health. There's still issues with delayed presentation, and there's also barriers to access. So for example, when people need interpretation support, there can be a delay in accessing that interpretation support, and again that prevents a barrier to getting that timely treatment. And again, they also highlighted people wanting more community-based interventions. And then in October, we had a community engagement event at Tottenham Stadium. And again, that was bringing together our stakeholders from the community and within our partnership trust. And we started co-producing PCREF priorities. And so it's not set in stone, this is an ongoing thing, but we've already started that work and understanding what our communities need. So from that community engagement event at Tottenham Stadium, I'll pick out a few things. So again, under each of the headings for the 6 PCREF cultural competency areas, for example, in terms of making culturally competent mental health service, people said they wanted improved early access. So for example, moving away from clinical settings and having interventions in places that, for example, cultural centres, mosques, community centres, libraries, just places that don't feel so intimidating to people. We have to be aware that people, as I said, they still have that stigma about coming to mental health services, and also the fact that people who may have already used mental health services might then have anxieties about going back to the places where they received treatment when they were at their most vulnerable and went through a really hard time. In terms of partnership working, so working with our colleagues such as the Advocacy Project, it would be great to have some templates for that working and some interactive tools, navigation maps, and that's something that we're really keen to develop. We've heard from other colleagues across the services that it would be really great, for example, to be able to have a dashboard of data to look at and refer to, but it would also be great to have a network, a directory of services, particularly for people from our Black, Asian and minority ethnic services. In terms of co-production and co-learning, again, people said that they want us to come to them, they want us to go to schools, do workshops in places outside of our trust, and also closing that feedback loop and telling them what's changed, what's going on. We've had things such as the community mental health transformation, which is in its 3rd year now, and people are still not fully up to date with what's happened. So it's about us getting out there and continuing to make sure that we feed this information back and let people know how we've made accessing services easier. And then in terms of workforce, again, they want us to celebrate the things that we're doing and empower people into professions. Again, there's a bit of an awareness that sometimes when you've got staff in particular services, it might not be reflective of the community. So we've got some great things going on at our trust, and we've got our Care Leavers Covenant, which is about helping care leavers get into NHS employment. And we've also got our Someone Like Me campaign, which is about encouraging people to get into the mental health professions so that we are more reflective of the communities we serve. And then in terms of staff knowledge and awareness, people have said that they really want professionals using service who are in services to make sure that they understand the communities they work with, the demographics of the community, and to have some sort of mandatory training so that people are more informed when they're engaging with service users and carers. So in terms of supporting communities and community services, how our local PCREF will support change? One of the biggest things that we're really keen to do is raise the profile of our ethnic-led voluntary community sector grassroots organisations and service providers. And again, that's about making sure that we're working together. There are some great statutory bodies who provide these statutory services, but it's about capacity building. So making sure that if we've got a particular client who has particular needs that we might not be able to accommodate, making sure that there's a service that we can refer to, because we know that there are lots of great grassroots organisations doing the work, but it's about making sure we've got those connections and ties and just building that capacity, learning from each other and helping each other so that we get those best outcomes for our service users. And we also want to make sure that we're facilitating more transparency about decision making and service provision. Sometimes we find that organisations who are quite big, they might not understand the nuances of communities. And so it's about making sure that we let people know why certain organisations exist, but there are also choices and other supporting organisations that can help them. One of the biggest things is that we want to make sure that we continue to increase our partnership working in collaboration. As I said, it's about building that capacity, but also helping each other, excuse me, and making sure that, as I said, if there are queries, questions, this service might not be particularly right, or we're finding it slightly challenging to help this person, making sure that you know there's somebody who can connect you with an organisational person that can help. And we also want to make sure there's better signposting. One of the things I personally found working within the mental health services, I started in my career in the NHS on a forensic inpatient female ward, is that advocacy services were there were leaflets, but it's about making sure that members of staff know how to signpost as well, because although advocacy services are there, we need to make sure that every patient is aware of these, knows about them, and also that their family members and their support networks know about advocacy services and how they can work together, that it's not an either or, that we're all here to help each other. And then we want to make sure that we've got accountability for our partner organisations. So again, that's making sure that people know who has been appointed to deliver services and that actually we're making sure that they're used properly and that they're delivering what they need to deliver. And we also want to influence increase the influence of our grassroots organisations for meeting the needs of local communities and working together to do this. So how can we support our communities? So this is about amplifying the voices of our culturally diverse service users, understanding what their needs are and making sure that that's escalated and shared widely. Also, greater co-production, and we want to make sure that you're working with us, we're working with you to make these changes for our service users. And it's also, again, as we said, about closing that feedback loop and making sure that we embed that sustained change cycle and making sure that we enable communities to advocate for themselves and are supported by advocates. And we also want to increase the involvement to implement our PCREF objectives and aims. And then we also want to let our communities know what is out there and how they can navigate the mental health system and support them in doing that by improving our collaboration with our partners. So how you can support service users and carers, I'm in no doubt that you're all doing an amazing job, but sometimes there are challenges, particularly when it comes to supporting our culturally diverse service users, and sometimes how we navigate this with staff within these services. One of the biggest things our service users often say to us is just ask. When you've got that first point of contact with them, ask them what their cultural support needs are and making sure that this is raised with their care teams and it's documented within their care plans. When service users receive documentation, and one of the things we find that, for example, if somebody's been detained under the Mental Health Act, it's have you had your rights read to you? Yes, they've received a leaflet. But it's about following up with those service users, asking, did you understand this? Do you need this in a different accessible format? For example, large print, Braille, do you need it in another language? And then it's about reviewing and going over the information to make sure that that has been understood and processed to see if there are any gaps in understanding. And it's also about asking if they're culturally and ethnically led services that can be referred to. As I said, one of the great things about signposting is that it's really helpful, it works, but we also need to have that directory. And one of the great things that's happening at the moment is an organisation called Thriving Futures has created a network map which details the services particularly for our Black, Asian, minority ethnic service users. And I haven't provided the details in this slide, but I'll send that information to Laura so that there's a link for you to also access this information, so that you can make sure that if there's anything that your service users need, that your clients need that they haven't got and it's not available to them, there is this directory that can help support that. And it's also about collaborating with community services to make sure that we're meeting your needs. So as the North London Mental Health Partnership, our advocates and the advocacy services provided is crucial, but it's about making sure there is that follow-up, that we're making sure we have those regular conversations. And then lastly, it is about escalating needs. I'm aware that within the course of doing your job, undertaking your duties, there are perhaps things that you come across that you think, oh, I just need a bit of advice on this, I need some support. At the North London Mental Health Partnership, we do have our engagement and involvement teams, but also even ourselves as the Equality, Diversity and Inclusion team. If there are particular things about service users or your clients' background that isn't being met, please do feel free to contact us. And there are also other organisations, as I said, such as Carers for Carers that can support people. Our service users can be carers, but also their carers who are looking after them. And there are other organisations such as CASPA, which is a culturally appropriate peer support advocacy service. So again, it's about tying in all of these networks so that we can provide that support. And also a bit of a plug for myself, we have our PCREF working group. And again, it would be great to hear feedback, follow up, and also if you wanted to be involved in influencing our PCREF, it would be great to hear from you. And I'm more than happy to follow up with anybody and have further discussions. So in terms of our community support services, we've got organisations such as Community Barnet, and we've got New Citizens Gateway who are based in Barnet, and this is for specifically for Black, Asian, minority ethnic service users. Mind in Enfield and Barnet, again, are also one of our big community support providers, but there's also an organisation called Precious Counselling, and again, they're really great, specifically supporting our Black service users. Again, we've got Mind in Haringey, and then working with them is Black Thrive Haringey, and they're an organisation, again, who is specifically providing services to meet the needs of the Black community in Haringey. Health Watch Camden are also a great partner to us, and then we've also got Voluntary Action in Camden, and again, they provide some culturally appropriate advocacy support services as well. And then Health Watch England, Health Watch Islington are also one of our support partners. So again, it's about working together, making sure that we're aware of the support we can provide, and making sure that we're not afraid to ask those questions when we see things, hear things, if there are issues of discrimination coming up. And again, we can support you if you need to escalate that, but also just making sure that we're constantly asking those questions about the needs of our service users and how they can be met. Thank you. That brings me to the end of the presentation. Do we have any questions?
Oh, sorry, Donna, I think you're on mute. Sorry.
Yeah. Yeah, thanks, Jordelle. That was absolutely fascinating. We don't have any questions in the chat yet, so maybe I can ask one to start off. I wanted to actually say a little bit more about intersectionality, because I'm aware that in North London Mental Health Partnership, you've got very strong women's strategy, and in particular, you've got services like Drayton Park, which are unique in the country. So, do you want to say a little bit more about how your women's strategy and your race equality strategy actually work together in the area?
Yeah, absolutely. So we've got really great links with our staff network. So across the partnership, we've got race networks, we've got women's networks, we've got our disability networks, and they work really well in terms of holding us accountable for our strategies. So for example, we've had really great strategies for menopause at the moment. It's about making sure that women feel empowered to ask those questions, to ask for that time off, ask for that additional support and their changes to their working environment. And then similarly with our race equality strategy, the PCREF, this feeds into our anti-racism strategy, which our partnership recently launched last month. And this ties in with the London People's Board race equality strategy, and this is about working together and having that intersectional lens. And also we know that our service users and also our members of staff, they aren't just one thing, they cover many different identities. And so it's about how we look at our members of staff, how they're being treated, how we're looking after their welfare, as well as looking at our service users and how they're supported. There's a great piece of work at the moment with our disability network to do with our disability passports. So again, it's making sure that people's needs are documented, recorded, and facilitating those conversations with managers. Because I think with all of these strategies, as I said, your anti-racism strategy, our women's strategy, our disability strategies, it's the middle managers that essentially the burden falls onto mostly to facilitate those conversations and those changes. And so we're really focusing on empowering our managers to have these conversations, make sure there's a safe space for those conversations to take place, but also that they've got the right tools to have these conversations and take forward those changes. Just going back to our disability network. So yeah, the passports that we've said for our members of staff who identify as disabled, it's about making sure that when people need to incorporate occupational health, it's not seen as this big, scary, threatening, right, occupational health are coming in and it's a punitive measure, but actually it's a supportive measure, and making sure that they're supported to have those conversations. And then just looking at our learning disability services as well, it's again making sure that our service users' mental health needs, as well as any learning disability needs that they have, are working together intersectionally and making sure that they complement each other. And we've got some great ties with our local authority council colleagues, and they're doing a lot of work, and so we're supporting them and they're also supporting us within those. So again, we're really trying to make sure that we've got our networks in place to hold us accountable, to support us, and making sure that for people who, like I said, we all have more than one identity, and making sure that that's complementary, and that we're making sure that we see people holistically. We always say that our community is made up of members of staff, and members of staff are our community. And that's exactly the same for our service users as well. They're not just service users, they're also members of the community and our workforce too. So they almost have triple hats, because we have a great peer support network of staff as well. So it's making sure that we see people holistically, and then making sure that they're involved in as many levels as possible for those conversations, for actions, implementing the actions, and also that governance feeding back as well.
Right, that's great, thanks. That was a very full response, really informative. We've now got a question come up from Winifred, who's asking, have you got any ideas about how we can get other boroughs to follow similar in-depth strategies?
Yeah, so we have been working, and particularly from the PCREF perspective, we've got a PCREF network lead, and so this is London-wide at the moment, and it's all of the PCREF leads from London. We're meeting monthly to make sure that we speak about our progress, any challenges we've had, and also making sure that we feed that back. There's great ties, obviously, nationally, NHS England launched a PCREF, so there's great ties there, and it's about making sure that we have those conversations. I'm also aware that there's a network for carers, again, which is national, but again, I think most of the membership is made up of London Trust. So it's again just sharing that information, making sure that people are aware that there are these networks of support that can be relied upon and that people can join. And I think one of the biggest things is putting that pressure, I say pressure in the nicest possible sense, on our leaders to make sure that we are sharing, because one of the things that we find that there's great pockets of work going on here and there, but actually we do need to come together and have that roundtable discussion to see what's working well. I'm very fortunate that I'm part of one of the race networks for London, again, which is looking at our race equality strategies across the borough. We had a meeting last week, and it was really great, because one of the things to come out of that, for example, was when members of staff have experienced assaults or racism from service users, looking at restorative justice models. So how do we sit service users and our members of staff down together, discuss the impact of the racial experience or aggression that they've experienced, and making sure that it's not, again, just about there's Operation Cavell, which the police support, so if people want to press charges, but it's about reinforcing that understanding and impact and how we move forward and get that understanding that it won't be tolerated, and we do have a zero tolerance approach, but making sure we understand the service user, what their perspective is on this, and how we can move forward together. But yeah, I think definitely we need to make sure that these networks that are existing, that we join them, that we're part of them, but it's also making sure that we pass this information on, making sure that we cascade it as far and wide as possible.
That's great, thanks. I can see we've got a question from Leanna here now, who's asking about the momentum with staff networks. Who takes the lead? How's that supported by leadership? How long has it taken to get it up and running, etc., etc.? And Leanna, you might want to come back on that as well.
Yeah, so our staff networks, we're really fortunate. We've got an executive sponsor for our staff networks who's very heavily involved. And within our equality, diversity and inclusion team, we have a staff networks lead. So we work very closely, just a bit very briefly. So our equality, diversity and inclusion team, we have community engagement leads, and we also have workforce business partners. So we've got staff networks, business partners and community engagement. So we're in a really strong position that between us, we triangulate that information. We also, myself, I'm also a member of one of our race networks. And so again, it's being a member of that, but also that feeds into my colleague who's the staff network lead. And then we make sure that we attend the networks. As I said, I'm a network member, but also in our capacity as equality, diversity and inclusion team members, so that when we've got things coming up, such as our anti-racism framework, that our race networks, for example, have had an oversight on this, they're able to add, challenge, and then also we feed that back up via our governance structures and also our engagement. And again, with our disability passports, our disability networks were really crucial in taking that forward. So that actually came from their support, getting that progress forward. So our disability networks and our networks overall are really strong. And we've got that great, as I said, we've got accountability right up at executive level. But on the ground, we've also got our network members who are working really hard to actively make sure that these changes and that these persistent issues are being addressed. Oh, and sorry, in terms of duration, sorry, Leon, I think you had a question about duration. I joined the North London Mental Health Partnership in 2022, and they'd already had strong membership and set up for the staff networks. But we've recently merged as a partnership. So we're a merge of Barnet, Enfield and Haringey, Camden and Islington, and we're undergoing an amalgamation as we speak. And it's been really great. There has been a bit of an apprehension about coming together as one trust partnership anyway, but amalgamating our staff networks, some of whom were at different levels than the other, and all of them had their own strong identities. There was a bit of apprehension about coming together, but we've had facilitated workshops as members, as core leads of those network groups, the chairs, and we've really come together now to align our priorities. And as I said, it's still a work in process. We're not out the other side yet. But yeah, we've really come together. So I'd say, especially in the last 6 months, there's been a lot of focus work with our staff networks to develop them and make them strong, and also align and make sure that they're continually involved in those key priority areas.
Thank you, that's great.
Right, has anyone got any questions that they want to ask but they haven't put in the chat box? Because we've still got another 15-20 minutes of Jordelle's time, so let's try and make the most of it. Everyone's gone very shy.
Please don't be shy.
Jordelle, was there anything that you didn't put in your presentation because you didn't have enough time that you'd kind of like to talk to us about now, that we can, maybe if you've got an example of something that's really changed in terms of practice as a result of this work?
Yeah, so at the moment, as I said, the patient and carer race quality framework, it was launched in November last year. So although there were pilot sites nationally, it's just been launched. And one of the things so far that has been really great is that we got the anti-racism strategy, which PCREF falls under. So at the moment already, we're changing the types of data that we've looked at. For example, our friends and family test data, this is collected on a monthly basis. And although it goes into our usual governance structures, actually we've taken a more culturally specific lens. So breaking that data down into, you know, how are our service users from our BAME communities specifically rating and faring using that. So already that data, which again, it was kind of amalgamated into, you know, kind of like all of the data combined, actually we're specifically pulling that out and feeding that back to our communities and service users. And already we're seeing there are some differences. And again, in terms of care planning, we use a tool called Dialogue Plus, which is a set of up to 14 questions that can be asked. And our trust, we were only using 11 of the kind of mandatory questions. And so we've actually developed a question about specifically people, cultural preferences and needs. And so incorporating that, that's something new that we've started already, which is great. And again, even having conversations when people have their one-to-one nursing sessions, for example, or their therapeutic time. Again, it's making sure we've got specific questions around people's cultural needs. What do they need? And also on our inpatient wards, they have community meetings. And again, making sure we've got a specific section of the community meeting agenda to say, right, what do people need? What are their cultural needs? And it's been really great in Barnet recently, for example. One of the issues that come up consistently across the partnership is food. And in Barnet, they've done a bit of a deeper dive and taken a quality improvement project approach to that. And we found out that actually something as simple as rice, it's, a staple part of diets across the world for many, many countries and cultures and communities, but it was actually something that we weren't serving. And so just that simple step of making sure that we've changed our food provider and just making sure we've got rice on the menu. It's a simple thing, but actually it's going to make a big difference to people to just have some of those comforts and familiar things that will help them as part of their journey. And also things such as there was a multi-purpose room, which is now being converted into a multi-faith room. And again, it's just those simple things. And sometimes I think when you've got big strategies and frameworks, it can seem quite daunting, but actually some of the changes can be really small. And I hate the term quick wins, but they are small, quick wins that make a massive amount of difference. And just to add in our other two boroughs, for example, in Barnet and also in Enfield, having culturally appropriate welcome baskets for service users when they come onto the wards, such as making sure they've got appropriate skincare products, hair products, combs. Again, it's something quite small, but actually makes a massive difference, especially when people are going through, challenging time, the most challenging time. Just having something that really reflects them and who they are is making a big impact on their experience of our services.
That's great, thanks. And I see that just having those practical examples has already got people asking more questions. There's a question here from some of the advocacy projects saying that service users have highlighted that when they speak to professionals, for example, in therapy about racial and cultural discrimination and the impact on them, it's quite often not dealt with or it's not heard in relationship with mental health issues. And I know there's been quite a lot of research on this as a problem. Can you say a little bit about the way in which that's being addressed in your trust?
Yeah, it's a very valid point, and it's something that is saddening to hear, but it absolutely is people's experience. One of the great things that we've got at our partnership at the moment is the trauma-informed collaborative, and taking a strengthened trauma-informed approach to make sure that we acknowledge that people are, have systemic racist, abuse. They go through things that there's structural racism that impacts them in the community, but it can also impact them when they come onto our wards. And I think there's a big fear for staff that when somebody mentions racism, there is that defensiveness that, oh, we're not racist, or this is something outside of us. But actually, just even that acknowledgement that somebody has gone through systemic racism, the impact of systemic racism has had on them, that's led them to where they are now. The data doesn't lie. People, as I said, Black men in particular, are more likely to end up under mental health act detention. Why is that? And again, it's acknowledging. So that's one of the first steps that our trauma-informed collaborative have really put out. And there's some great training going on. We've also developed some specific training. So our newly inducted nurses, when they start in our trust, they're undergoing this trauma-informed training to make sure that they really understand the principles of understanding people's trauma and not asking them specifically, what's wrong with you, but what happened to you, and understanding and embedding that in their practices. And we've also had a great service user film that the EDI team helped to commission and develop. And we've had a local filmmaker who was a service user, and he worked with the Tottenham Talking, they're part of our partnership, who deliver services in the community. And there was a project working with 5 service users documenting their experiences. And that film has been used as part of our trauma-informed training, and some of the perspective it brings up, you know, people being members of the workforce, people's family trauma, how that has impacted on them, people's dual diagnosis, you know, struggles with alcoholism, and again, issues with immigration, issues with, like I said, just fractured relationships, just seeing everybody's trauma, but specifically highlighting where there's trauma that impacts the BAME community. So yeah, we're embedding that, and that's working really well at the moment. We've piloted it, and we're now going forward, as I said, with all of our newly inducted nurses.
Yeah. What about the psychiatrists? Are you mentioning get any buy-in from them at all? Because without wishing to generalize, quite often I think that nurses are great. It's when you get elsewhere in the mental health system that you come up against this failure to take into account the whole person. So I don't know about how much engagement you've had with psychiatrists over this programme.
Yeah, so we started locally in our Haringey borough, and we have got some great buy-in from our psychiatrists there, and our therapies leads are part of the Trauma Informed Collaborative. Over in Enfield, our therapies lead is actually a woman from a Black background. So again, it's great to see we've got that representation at that high level, and she brings with us, you know, her own personal experiences, lived experiences, and that perspective. And also with talking therapies, as part of the data we looked at for the State of Inequalities report, we found that with talking therapies, particularly for our younger people, that the number of them completing the treatment was significantly low. And then again, there were inequalities in the number of people from, as I said, Black, Asian, minority ethnic backgrounds completing talking therapies. And speaking to our therapists, they've been great. They've been open to hearing these conversations about making sure that they are more informed about communities, and also recognizing that therapy such as CBT isn't a one size fits all. And actually there are other models that they need to use and to look at. And also bringing in our talking therapy and counselling services in the communities. We've got great BAME-led talking therapy services, and it's about bringing them on board as well, making sure that people are signposted to them and have that option. But, you know, we've got our, you know, statutory NHS talking therapy services, but our psychiatrists really need to understand that it's not that we're saying they're bad, that their practices are bad, but making sure that they've got their awareness, and that actually people do, when they come to these services, if they don't see a therapist that reflects them, making sure that they are reassured that the therapist is culturally competent, culturally aware, and there is also that option of there are other service providers that can help as well.
Yeah, that's great, and thank you for indulging one of my bugbears then. We've got a question here from Zakia, who's asking, can you say a bit about the core challenges that you encounter with statutory services when you're carrying out this work?
Yeah, so one of the biggest things is that to say it's a new framework, people are like, oh my gosh, what do we need to do for this now? But actually, one of the things to highlight, and that I often lead with, is that although this is a new framework, the work itself isn't new. And I have seen some great work, and there is some great work going on across our 5 boroughs, but they're pockets of work. And so the PCREF, for me, I see is actually bringing all of that work together, centralized in one place. And also that our services cover such a range of boroughs, each of them with their own demographic differences, each of them with their own challenges, priorities, and focus areas. And so actually it's about saying that although we initially have some great buy-in, people are often saying, oh, but we're already doing this, or actually we're not doing that. How do we do that? And again, it's about letting them know this is a supportive thing. It's not, you know, we're going to bash you over the head because you're not looking after our service users from the Black community or other culturally diverse communities, but recognizing that we need to do more work, that it's not a blame, but it's about making those improvements. And actually that once we're improving things for our community, our service users and carers, that will ultimately improve staff working relationships as well, and also how staff work. When we speak about race particularly, sometimes it can, like I said, it can be met with a bit of defensiveness, not in that people don't want to do anything, but it's that accusation almost of we're not doing enough. But actually part of this is taking stock of what we're already doing. And I think people are surprised. We're like, oh, actually, there is a lot going on. And if it's not happening specifically within their service, there's another service or division that's doing it. And it's about that shared learning. I think even as a partnership covering 5 boroughs, we need to do better at sharing our learning. And sometimes it's time pressures. You know, one of the biggest things is that people are busy, it's that time. And actually it's about building that capacity, not just within ourselves, but as I said, with service providers such as the Advocacy Project, with our grassroots organisation, to build and support each other. You know, we've got long waiting lists, for example, just bringing it back to talking therapies. People, you know, once they've got through the hurdles and the thresholds and they meet the criteria, they've then got a 6 to 9 month waiting list. What are we doing to support people in that time? And that's when we can lead on our VCS sector and our grassroots organisations. So it's about getting that buy-in that it's something new, but it's bringing it together, and about increasing that collaboration so that it's not so onerous, because at the end of the day, we all want to do the same thing. Nobody works within these kind of statutory services. You know, for example, for the pay, it's about a passion. It's something you want to do and want to do well. And I think making sure we have that pride, but that we recognise we can't do it on our own, and making sure that we support each other in that. So yeah, that's definitely been that challenge of there's that initial buy-in, but actually what resources are available. Well, let's just look around.
Right, we've got a message from Rachel saying, can she contact you about the Camden Autism and Race Equality Network, because she'd like to share their experiences that autistic people have had of mental health services in the borough. I'm assuming that's a yes.
Yeah, absolutely. Thank you, Rachel. That
Yeah,
would be
and
great.
are your contact details on your slides when we circulate them?
No, they aren't, but I have sent them to Laura, but I'll be happy to put them in the chat as well.
Oh, great. If you could do that, that'd be brilliant. And then we've got a question from Diana saying, what facilities do you have, or are you thinking of doing with people who have mental health and diabetes? Is there any sort of referral system?
Yeah, so our physical health leads are really great, and they've been doing a lot of work around physical health checkups and working with other community groups. For example, there was a big focus on prostate care for men, but making sure that, yeah, hypertension, diabetes, obviously, you know, there are real biggies. And so there's a lot of work going on, and looking at it specifically for our Black and Asian minority ethnic service users is something that we want to drill down to. At the moment with the PCREF, as it is still in development, in its infancy at the moment, we are working with our physical health leads to see how we can action that. But yeah, the physical health checks, I think in Enfield in particular, of the London boroughs have got some really great success with making sure that people have had their physical health checks, including diabetes care. But yeah, that's absolutely an area that we recognise for our service users, particularly when they're coming to us with comorbidities, that we need to do better at. So yeah, it would be great to have a follow-up conversation about that, to see how PCREF can strengthen the mental health, but also physical health areas as well.
And there's a question here about access to interpreters. It's a real struggle for voluntary sector organisations, because our budgets and our contracts don't always include the cost of interpreters, and we can't afford justifying that money ourselves, and it just become a barrier, particularly for advocacy. Is there anything going on in the trust in the work you're doing that would actually help lift that barrier for people who need an interpreter to help support with their advocacy needs?
Yeah, absolutely. So we have actually just renegotiated our contract with our interpretation service provider. And one of the challenges I think that there is with interpretation services was that after COVID, or during the pandemic, lots of things went online, lots of things were telephone consultation, and there has been a bit of a reluctance to move back into face-to-face support. But we're really pushing for that. But we also recognise the need that we still have this big backlog of needs for requests, and there are delays. So we are still utilising telephone support more. But one of the things we're finding, particularly with our voluntary community sector, is that utilising members of staff as well to help with that, so that if there is a particular language that is needed, and we do have members of staff that can provide that interpretation, that we're using our, you know, resources that we have available to us. So I think at the moment, sadly, it is still a waiting game in terms of we're not perfect, particularly at this trust with our interpretation provider, but we are getting there. And we're also looking at exploring things such as AI technology. Again, it's not perfect, but how we can use that to speed up the delays when getting interpretation services as well. So again, we're trying to really make sure that we are looking broadly and widely for this support. But yeah, it's not perfect. And as I said, the pandemic, it has kind of pushed people into wanting to do telephone interpretation rather than face-to-face. So yeah, we're relying on our staff and to help in those situations. And again, it's not a perfect model, but we're meeting the needs as fast as we can. And I think for us, that's the priority at the moment.
That's great. Has anyone got any other questions at this point? We've got about 5 minutes left. If anyone's got a question they haven't asked yet, if you don't want to type it, just indicate the little hand and we can call you. Nope. No last question from anybody. Well, thanks very much, Jordelle. That's been absolutely fascinating. It really, really has. And I love those kind of examples that should be things that should be really straightforward. I mean, how can it have taken so long for them to realise they weren't serving rice? But it's great that you've been able to do that, and that makes a huge difference to people. Food is such an important part of most cultures and such an important part of how we feel good about ourselves. So thank you for that, and also thank you for your passion. You're one of the most enthusiastic speakers we've had at one of these events, which we really, really appreciate, because it's a hard old slog doing race equality work in the NHS, because it feels like everyone works really hard and then the gains are quite small. So your passion and your enthusiasm has been really appreciated, and keep up the good work. And I know you're going to have some contacts from this of people getting in touch with you, and I know that certainly some of the advocacy project staff on the call will be looking to talk to other boroughs that we work in about some of this work and how their boroughs can learn from that. So you may be hearing from a number of us, and I hope you can see in the chat people saying thank you and everything else. And as I say, we'll put the slides on our website, and Laura will circulate them for everybody so that the information gets out far and wide. And thank you all of you as well for joining. I know that people are really busy and an hour out of the day is a lot, but I hope you've all found it really worthwhile. It certainly looks like it from the comments in the chat. So thank you everybody, and look out for details of the next Advocacy Project Speak Up lecture. So thank you and goodbye.
Thank you, everybody. Thank you.